So today we're going to talk about gum recession. This is a huge topic that comes up almost on a daily basis for any hygienist. So the first thing I want to explain is there's three major parts of your tooth. So you have the enamel, you have the cementum and or dentin, and then you have the nerve of the tooth. So if we look at a model, this would be what your teeth would look like. So the pink obviously is your gums. This white part of the tooth that you see on a daily basis that you're naturally supposed to see, that's your enamel. The enamel is the hardest substance in your body. It is not, it's porous, but it's not. So this is harder than bone. But if we take this tooth out and kind of dissect it, every tooth in your head is the same. You have enamel that covers the tooth to a certain point. And it usually, this is naturally supposed to go about 1 to 2 millimeters under the gum tissue. This is your root surface. This is your root. This surface is more porous. This is cementum, and then if you wear through the cementum, it's dentin. So this is the root surface of the tooth. This is more porous than your enamel. This is the second hardest substance in the body, okay? So inside the tooth is where the nerve sits. It sits inside the tooth. It comes down through your jawbone, through your skull, into these root tips, down the center of the tooth, okay? Looking at the three parts on an x-ray, the outer whitish shell of the tooth is the enamel. You can see where it stops. The second layer is the dentin. That's the inside part of the tooth, the second major layer of the tooth. And then inside where the nerve sits is the pulp canal. That's the centermost part of the tooth where the true nerve of your tooth sits. And this is where the nerve enters through the jaw, through the skull, through the bone, gives the tooth the blood supply that it needs. Biggest misconception is people say, I have nerve exposed on my tooth. There's a nerve exposed. If you had your nerve exposed, you would have had to crack your tooth in half. This tooth would never be root canal. It would be, healthy nerve, again, sitting down the center inside this tooth that you never ever see. It's never exposed. You have to drill through the tooth to get to it, okay? So one myth to say your nerve is exposed, that's a false statement, okay? What happens is your root surface of your tooth is exposed. So naturally, again, let's look at this again. This is what your teeth should look like. You see enamel, gum tissue. The dentin, the root surface is under the gum tissue. It's down underneath here. You can't see it. When you have bone loss and you have gum recession, okay, you start to see that root surface is exposed. I don't think this will stay here, but we're going to try. So let's just say this is an exaggeration, of course, because this is not a natural tooth, but I'll insert some photos of some teeth, particularly mine, where I have gum recession. So if you have gum recession or bone loss, the roots of your tooth are exposed. Here's the root of your tooth. Naturally, your tooth should look like this. It looks like this. You can see this. So here's a picture of my teeth. You can see the enamel. Then you can see the darker portion up towards my gum. That's the dentin. That's where I have had gum recession and my root surface is exposed. Now, when you brush across here, again, this surface is more porous. It's loaded with pores like your skin. Every pore is connected to a tube. That tube runs to the nerve of your tooth, which again is in the center of the tooth. So there's fluid inside that tube. If these pores are not clogged or blocked, and you have hot, cold, or sweets, sometimes air hits this root surface, and those pores aren't blocked, what happens is the fluid inside those tubules move, and it gives you that, holy cow, that hurt, and then it goes away. Some people can feel when you're in the office, you can feel our instruments, which are stainless steel. When we run over the surface of this tooth, it's very uncomfortable because we're stimulating it. So we're just stimulating the sensation. If you put your fingernail there, you can do the same thing. I've had people come in and go, when I do this, it hurts. Well, stop doing that. If that's the only time it hurts when you dig your fingernail in there, don't dig your fingernail in there. So what you have to remember too, again, hardest substance in your body, this is the second. So if those pores and everything are not clogged or blocked, it's conducting that sensation, I say it's like conducting electricity. So what do you need to do? You need to clog or block those pores, okay? Now, again, let's make this point really quick. When you brush this surface, if you scrub really hard, you will wear this surface down. It is not as hard as your enamel, and if you're an aggressive, heavy brusher, which you should not be, because these are not rubber on your car tires. These are teeth and gums. Heavy pressure doesn't help you for a short period of time. Gentle brushing for a full 2 minutes is fully effective. Soft toothbrush only ever should use soft, soft, soft. Never hard, never medium. They're too aggressive. They will wear this surface down. And then you get lesions on the side of the tooth called abfraction lesions. They call them erosion lesions. It looks like you chopped a wedge in the side of your tooth right at the gum line. And again, I'll show you a picture here exactly what it looks like. So that dark area right there by my gum line, that's an abfraction lesion. If you looked at it from the side, it looks like a wedge. And that's an abfraction lesion, and that can also be caused by toothbrush abrasion from you scrubbing super hard at the gum line. So we don't want you scrubbing hard. Now, to clog or block, what's the best thing to use? Well, Sensodyne uses potassium nitrate. That clogs or blocks the tubules. Tom's of Maine has a rapid relief sensitive toothpaste. To me, this is the best toothpaste you could buy. It uses arginine and calcium carbonate. Those two ingredients absorb into the tooth, clog and block the tubules, also preventing decay on the tooth. They work extremely well. Sensodyne, I have found for most patients, if you use it at the start of sensitivity and use it for 3 to 5 days and then stop using it, that's when it seems to work the best. When you use it for the time that you need it. I have patients that use it every day. They've come into the office and their teeth end up being hypersensitive. So I have done an experiment with them. And again, this is 20 years of my clinical experience speaking. Okay, try backing off. Try using the Sensodyne once a day and a regular toothpaste the other time a day when you brush. So I'd say use the Sensodyne at night so it sits on your teeth and works all night, and use a plain Colgate cavity protection toothpaste on your teeth in the day. Because again, whitening toothpastes are abrasive. They have grit to them. They can scratch and abrade the teeth. They can actually strip away any protectiveness that a Sensodyne or a Tom's of Maine is going to place on your teeth. So when you use these toothpaste, whitening in particular, tartar control in particular, they will strip your teeth bare and raw, and then you get sensitivity. Citrus foods, acidic foods, all of those things, eating and drinking, can strip your teeth raw and take off all of the good not even minerals, but the ingredients, the potassium nitrate, the calcium carbonate, the arginine that are in these toothpastes to help plug and clog the pores on that root surface that are exposed. So if you are a chronic Sensodyne user and you still have chronic sensitivity, then I would back off. I would use it once a day. Use a plain toothpaste another time a day, see how your teeth do. And then if you can skip a day, go every other day, see how your teeth feel. If you're experiencing less sensitivity, well, then you're basically detoxing your teeth, and then you're allowing your mouth to kind of heal itself, and you don't necessarily need it, because I have found, and it's just my hypothesis from talking to people and looking at their mouth and having discussions, that sometimes the Sensodyne, that the teeth overreact to it, and they can only absorb so much potassium nitrate before they end up, it doesn't help their sensitivity, it actually increases it and makes it worse. So that's where it goes back to use it only as you need it. Use it for a couple days, stop, see how your teeth feel. If it's chronically sensitive, then maybe put a little bit on your finger, rub it on there at night before you go to bed, and go to bed, and then use it in one area until the sensitivity calms down. If you want to try no toothpaste at all, one of my doctors I worked for read a study about baking soda. You can use baking soda by itself and brush your teeth or rub it on the areas that are sensitive, and that is to help, allegedly, to soothe some of the sensitivity, and my patients that have used it a lot of them have found some good relief with it. So again, that's not something you'd use every day, but it's something you can use temporarily to plug and clog up those pores so you don't get that sensation and that fluid moving inside those tubules. Tom's of Maine is the other toothpaste I mentioned. It's the Rapid Relief Sensitive. This is my hands down favorite paste for sensitivity. I use it. It's what I have in my arsenal of toothpastes because I have 3 different ones I go between. But I'll use it every once in a while. I don't need it every day. I don't use it every day. If I'm going to whiten my teeth, then I'll use the paste. If I'm going to get my teeth cleaned, I'll use it for a couple days before I get my teeth cleaned, because again, it just kind of clogs up the pores. Any sensitivity I feel with my cleaning, it makes it not there and non-existent. But I have found with patients that are chronic Sensodyne users that immediately switch to the Toms in the same day, they get hypersensitivity. So again, this is where I think that the mouth and the teeth need a detox from Sensodyne, and then you can start with something fresh and something new. So let's talk about the differences of Sensodyne really quick. All the different Sensodynes, they have the different ingredients. There is either a percentage, very small percentage difference of fluoride that's in there. Most of them use a sodium fluoride with potassium nitrate. But in general, the ingredients are almost all the exact same. So if it's a whitening one, it's going to be more abrasive. If it's a tartar control one, there's going to be a different ingredient in there. Some of them will use stannous fluoride versus sodium fluoride. Stannous fluoride can stain your teeth and cause brown staining on there. It does help kill bacteria, stannous fluoride that is. But the staining to me is not worth the side effect, because if you really want to kill bacteria in your mouth, you need to brush twice a day for 2 minutes. That means 4 minutes a day. And you need to use a water pick for 1 minute a day. So a total of 5 minutes a day. Those 2 things with no toothpaste and just water will effectively clean your teeth, disrupt bacteria, remove food debris in a completely gentle and safe way without having any product. So one other thing to add is there's sometimes the sulfates in toothpaste. Sulfates are added to make toothpaste foam. They're unnecessary. They just are a foaming agent. People can be allergic to them, and I don't want to really say allergic, that's the wrong term to use, sensitive to them. I've seen people get chronic aphthous ulcers in their mouth, little sores in their mouth from the sulfates. Their tissue has been super red. Their gums are red. Their mouth looks just burned in general. But also they can strip the teeth and they can cause more sensitivity. So there's a toothpaste out there called Closis. It's another one that I use. It's one of my favorites. There's no sulfates in it. So it's a very mild flavor. They have about 5 ingredients in the toothpaste. It doesn't foam. It's not gonna burn. It's not gonna cause an ulcer. It's just a smooth, nice toothpaste that works extremely well in fighting bacteria and cleaning your mouth in a very effective way. So that's kind of the ones that I like to bounce between, is the Tom's of Maine, the Rapid Relief Sensitive. I love Closis. That's just 2 out of the 3 that I use. So let's recap real quick on the sensitivity. 1, it is the root surfaces of your teeth that are exposed. It is not a nerve that's exposed. You do not have nerves exposed. So if your hygienist seems irritated when you say, I have nerves exposed in my mouth, that's just a myth. It's not a reality. You would not be able to talk very well, because just the breathing and your air passing over your teeth, if you busted your tooth and the nerve was truly exposed, you'd be in such pain that you would not want to open your mouth, okay? So keep that in mind. What happens when you have dentinal sensitivity, hypersensitivity, the root surface of the tooth is exposed. So those pores on that surface are not clogged or blocked. They're wide open, and they're connected to a tube, and that tube runs to the nerve of the tooth, which is in the center of the tooth. When hot, cold, or sweets, brushing, fingernails hits those surfaces, it gives you that little jolt. and it's like, ooh, that didn't feel good. It goes away very quickly, but it doesn't feel good. So what you need to do is clog or block those pores. So how do you do that? Sometimes you have to go to an extreme of getting a filling on the side of the tooth, or even a fluoride treatment. Your dental professional, your dentist, would recommend those. They're considered class 5 buccal or facial fillings, which is describing the surface of the tooth that they're going to be placing a filling on. So it's mostly for insurance purposes and charting purposes when we look at your teeth, what fillings you have and where they're at. So those are tooth color. They're usually white. They put them on the outside of the tooth. There's usually never any drilling involved because it's already a notch on the side of the tooth. They just put a material over there to kind of scratch the surface, clean it extremely well so that when you put the filling material on, it sticks and stays there. So they're nice when it's an extreme and the tooth just hurts all the time and you can't get any relief from no matter what you try. So those situations do happen, but for general overall purposes, the toothpaste work really well. The baking soda alone can work really well. And then again, just kind of playing a game and experimenting and be open to changing when you're stuck with one paste, particularly Sensodyne, all the time. And you still have sensitivity because it's not really working for you. Okay, then maybe let's switch it up and see what we can do to make it work better. And then sometimes people come in and they have tartar over the top of those surfaces up there. And then when we clean your teeth, of course, we remove that chunk of tartar. So what's underneath there, it'd be like taking off a jacket outside in the wintertime. The tooth is exposed. It's a kind of like a raw part of the tooth again, so you can get a little sensitivity. And even after getting your teeth cleaned, we strip everything off your teeth when we polish or air polish your teeth with our paste that we use. So that can strip the teeth down. So that's another reason why you can get sensitivity after your dental cleanings. But, you know, fluoride treatments are always a great option in an office if you're not opposed to it. That's just now they hardly ever use the tray system with the foam or the gel in it that it sits in your mouth for a minute. It's now a varnish that gets painted on the teeth. It leaves a sticky residue. Works really good. Again, it'll work up to 3 months. It can plug up those pores. It's just sticky for a few hours after you're cleaning. You don't brush it off for like 4 to 6 hours, and you don't have hot liquids. That's usually the directions with it. But that's pretty much the gist of dental hypersensitivity. So I hope this helps you all. Thanks for watching. I appreciate it.